afternoon. I am Kimberly Jeffries Leonard, President of the Links Incorporated. I am so thankful to be here with our partner, Black Health Matters, who has brought this critical interview to fruition. And I am especially pleased to be sitting here with a household name, a man who needs no introduction. He has become a trusted advisor on COVID-19. He is the world's doctor, Dr. Anthony Fauci. Dr. Fauci was appointed to director of the NIAID in 1984. He oversees an extensive portfolio of basic and applied research to prevent, diagnose, and treat established infectious diseases such as HIV/AIDS, respiratory infections, as well as emerging diseases that we've seen such as Ebola and Zika. The Institute also supports research on transplantation and immune-related illnesses, including autoimmune disorders, asthma, and allergies. Dr. Fauci has advised 7 presidents on HIV/AIDS and many other domestic and global health issues. He was one of the principal architects of the President's Emergency Plan for AIDS Relief, PEPFAR, a program that has saved millions of lives throughout the developing world. Dr. Fauci has delivered major lectures all over the world and is the recipient of numerous prestigious awards, including the Presidential Medal of Freedom, the highest honor given to a civilian by the President of the United States, and the National Medal of Science. Dr. Fauci, thank you so much for joining us in Black Health Matters to talk about this critical issue.
Thank you very much, Kimberly. Thank you for having me. It's a pleasure to be with you.
Well, it's my pleasure. So let me start some questions for you with the most current piece that has come out with regards to COVID-19 vaccines, that of the issue of children. Can you please give us your best advice on how to convince parents to get their young children between the ages of 5 to 12 vaccinated?
Well, first of all, it's to give them the facts and the data that there are, for example, children between 5 and 11 years old, which was just recently given the EUA from the Food and Drug Administration and approval from the CDC. There are about 2 million children have already been infected within that age category. Many of them have gotten a significant amount of serious disease, and close to 100 of them have died. So although it is true that with children in that age group, it is less likely that they'll have a severe disease compared to an adult, particularly an elderly adult, but they're not exempt from serious complications. So you want to protect the children. Secondly, children can spread infection within the household and in the school. So you have the secondary effect of helping to contain the outbreak. And third, and importantly, the vaccines are extremely effective. The vaccine that was recently tested for children 5 to 11 was 91% effective with a very, very good safety profile. I think parents need to know that. And if they do know that, I feel really confident that they'll come through and get their children vaccinated to protect them and to protect the general community.
Well, we will certainly do our part in the Links Incorporated and through our partnership with Black Health Matters to get that information out, to see if we can get that needle moved on the number of children that are vaccinated. And thank you for clarifying that it's 5 to 11. I am so fortunate that within the Links Incorporated, I have a phenomenal COVID-19 task force led by physicians and infectious disease and public health experts. And that has really helped guide us through your science around how we need to approach COVID-19 and the things we need to do to keep our membership safe. But one of the things that we've been trying to impress upon not only our members and our communities is the issue of taking more than one vaccine at a time. Can you talk a little bit about, I know you said it before, but please help us understand whether you can take the COVID-19 vaccine and the flu vaccine at the same time and why it's important to get both.
Well, the answer to your question is very easy, Kimberly. It's yes, you can take the flu vaccine at the same time as you get the COVID-19 vaccine. So you shouldn't be hesitant to do that. You go into the office, whether that's a pharmacy or a doctor's office, get one shot in one arm, the other shot in the other arm, and you're good to go. It's very important to get flu vaccine because when you get into the winter, you don't want the confluence of multiple respiratory-borne infections circulating around. You want to cover 2 of them, the 2 really important ones, which are flu and COVID-19.
Okay, so we will make sure that our members, when they hear this interview, so that we will make sure that we're getting both of those, and we'll make sure that we continue to press in our communities the importance of that. But thank you, coming from you, I think that's invaluable. So you mentioned the flu vaccine. We know that we need to get one every year to boost. How long do we expect the immunity to last from the COVID booster? And will we need to get that every year?
Well, the COVID booster, if you make sure people understand what we're saying, that after you get your primary vaccination, for example, if you get Moderna, you get a prime, and then 4 weeks later, you get a second shot. When we say booster, we're talking about a third shot around 6 months or more later. We don't know how long the protection is going to last from that. I'm hoping that it will increase dramatically the durability of response. So only time will tell. It is conceivable that we may not need yet again another shot for another considerable period of time. But the only way to find out, Kimberly, is to just observe and continue to follow people to see 6 months, a year later, do we need another shot or not? I hope we don't. I hope the durability is much, much longer than the original one.
We hope that too, because the goal is for us to get as close to normal, or this new normal, as we possibly can. So as we move to pushing and encouraging, continuing our encourage our members, our families, our communities to get the vaccine, whether it's the first, the second, or the booster, what do you think about the concept of getting these in the workplace? I know very many of us can just go down to our health facility in our workplace and get a flu shot. Do you think that having this in place for the COVID-19 vaccine will increase the number of people who get it?
I do. The way I always say, Kimberly, whatever it takes. And if it takes in the workplace, let's do it. Anything that makes the administration and the reception of vaccines convenient and easy for people, I'm very much in favor of.
All right, well, we will take that word to the bank. So we're moving. We see the numbers. I think that sometimes they're up and sometimes they're down, and we will continue to ask members, communities to get the vaccine, continue to social distance, wear masks when necessary. But Dr. Fauci, tell us from your perspective, what will it look like for us when we move from pandemic to endemic, and what will it take for us to get there?
Well, first of all, the easiest way to get there, the time-honored way of handling outbreaks, is to get as many people vaccinated as you possibly can. Unfortunately, currently in this country, we have about 62 million people who are eligible to be vaccinated who have not yet gotten vaccinated. We've got to get those people vaccinated. The sooner we do, the sooner we'll get to what you say is endemicity. Well, when you say endemicity, that really is some degree of control. It's no longer in the pandemic phase. It goes down to a more controlled. The critical issue is that the bracket within control is wide. You don't want to control it at a level of 50,000 infections a day. You want to get it way, way, way down. In my mind, well below 10,000 a day. At that point, we'll be able to, I believe, assume a much greater degree of normality than we're doing right now. The continued infections are going down, but they're starting to plateau a bit, which is a little bit concerning, which is essentially a red flag message telling us, don't stop getting people vaccinated, continue to get people vaccinated.
Okay. Well, we are, as I said before, we are going to push that. As we close, what would you like to leave us with, Dr. Fauci, America, the world's doctor? What would you like to leave us with as we continue to fight this fight against COVID-19, the deadly pandemic? And what would you like us to do to help move this message?
Well, the one thing I want to make sure people understand, that African Americans have the unfortunate situation of having a higher incidence of getting infected. And because of underlying conditions, that when you do get infected, you have a higher likelihood of getting a severe outcome, which is all the more reason to encourage each other within the Black community, to encourage each other to be able to get vaccinated as quickly as you possibly can. Because if you do, then my final message, Kimberly, will be this will end. I know we've been in this for a long time. We're all getting exhausted by it. It's been 20 months since we've been going through it. We have the capability within our own resources to end this, and you end it by getting vaccinated.
You know, I know that we are going to let you go, but I want to ask one or two just more critical questions. So we know that vaccinations is the easiest way to protect ourselves against getting COVID-19, or when we get it, minimizing the symptoms and preventing deaths. Tell us what we should do now. What are the guidelines now when somebody is infected with COVID-19? What should we do?
Well, right now we have, very importantly, a couple of pretty good therapies, particularly for people who are at a higher risk of severe disease, people with underlying conditions, the elderly. We have monoclonal antibodies. That's very important. We have now orally administered drugs, one that's received an emergency use authorization, molnupiravir, another one from Pfizer that has done very good results in a clinical trial that are applying for an emergency use authorization. The other thing is, after you've been infected, when you recover, it is recommended that you still get vaccinated to give you that extra bit of protection against reinfection.
You know, there are a number of people who do feel as though because I've had COVID, I have antibodies, I don't need to be bothered. So I'm really glad that you said that they can get vaccinated. How long do they need to wait after they receive, if they have COVID?
You know, in general, it isn't definitive when it should be, but anywhere from 30 to 90 days.
Okay, all right. I have one more question that I would like to ask related to how we manage the message around those who get COVID, those who need to get vaccinated, and those who feel as though the vaccine is too fast. I know that you have said in many instances, we had the opportunity to have Dr. Kizzmekia Corbett on one of our town halls to talk about the vaccine process. This didn't just come up. I know you mentioned the FDA provided some emergency authorizations. I think when people hear that and when they see that, they don't realize the work that has already gone in to doing these, getting these vaccinations in place and getting these medications in place. Can you speak about that just a little bit to alleviate some of those falsehoods that are out there about how long that it has taken to get these vaccines in place?
Well, what people need to understand is that the work that went into this started 15 to 20 years before the virus was recognized as a new virus. The work that went into the mRNA vaccines, the work that went into the design of the immunogen is work that goes back. And you heard from my colleague Kizzmekia Corbett that they had been working on that for over 10 years to do that. So this isn't something that was essentially corners were cut to do it quickly. No corners were cut. The science was not compromised, nor was the safety compromised.
I think that that is a perfect way to end. Dr. Fauci, I can't thank you enough for your time. I can't thank you enough for bringing this important information to our community, to our members, to all that are gathered here to watch you give us really the information from the world's doctor himself about COVID-19 vaccines, immunizations. So I think that we want to leave here. Get vaccinated, people. Please get vaccinated. Dr. Fauci, thank you so much.
Thank you, Kimberly. Good to be with you.